Thank you all so much for coming. We can get started now. We're going to talk about some heavy stuff today, so I wanted to start us off with some silly, happy stuff with those pet names. But I'm really excited that you all are here. Welcome to the Best Friends Network webinar, Caring for the People That Care for Pets, Prioritizing Staff Wellbeing in Animal Welfare. My name is Caitlin Durkin. I'm the manager for Network Partner Experience at Best Friends, and I'm here to get you started, share some housekeeping things while also framing this problem that our excellent panelists will then respond to. So let's get the boring stuff out of the way real quick. You will see on your Zoom two options for communicating with us. One of those is the Q&A. We ask that you do put any questions you have for our panelists there. It helps those questions stand out for us so that we can answer them. We probably won't be able to answer all of the excellent questions, but still please put them there. We review them after this Zoom session to see if we can use any other content to answer your questions. We also have the chat there. That's great for reactions, talking to other attendees. Our panelists might be in there a little bit as well. Feedback, I'm really honored to have your time right now. And that means I take it seriously that we use your time well. So there will be a 1-question short survey right at the end of this session. You're also very welcome to email bfnetwork@bestfriends.org with longer feedback if you have it. We will also have the webinar and the presentation deck available for you within 3 business days. Before we go any further, I want to say a very sincere thank you for everyone who is attending live or watching the recording. As we're going to discuss, you all have very difficult, busy jobs. And so you've made time to come here and think about ways to do it better, to support the animals better, but also to support your community better. And I just find that really impressive and really honored to have your time and attention. I want to introduce our incredible guest speakers today. First, we have Michael Kiley, Vice President of the Animal Protection Division at MSPCA in Boston. Gateway Pet Guardians was also kind enough to send 2 folks our way to give us 2 different perspectives on creating a culture and structure of staff well-being. So we have Alicia Vianello, Executive Director, as well as Amanda Loki, Adoption and Foster Manager. And then finally, we have Leah Craig Chumbley, Executive Director at Brother Wolf Animal Rescue. All of these folks have done great work in terms of promoting staff well-being at their organizations, and I think you're going to find their insights really valuable. We also have a moderator with us today. That's Dr. Amanda Weiss, PsyD. She is a licensed clinical psychologist, and she consulted on some of the research that I'm about to present to you to frame this problem of staff well-being. She also works with people in the veterinary field, addressing their particular kinds of trauma. So she brings a lot of expertise to this conversation. She's going to drop in the chat her contact information in case anybody attending would find it useful to reach out to her. Before we get into it, I want to frame the problem that we are dealing with. I am sure that everyone in this webinar has personal experience struggling with well-being in a shelter or rescue environment, but we can also think about it structurally. My colleagues Peter Wolf and Maureen Gillespie are part of the analytics department at Best Friends Animal Society, and they published this study in 2023 that I think you all will find really interesting, and I also hope you will find useful. I'll get into the methodology of it, but I want to start by saying what I want to ask you to take away from this presentation I'm giving. And that is that shelter staff and rescue staff should be considered first responders, that you all are providing an essential community service, and that you are experiencing the stress that really merits and requires investment. I'm hoping that after seeing some of the evidence supporting this claim, that you'll be able to use this to make changes within your own organizations, that especially if you're in a position of leadership, to create structures that better support staff well-being, but also to advocate for yourself, that this is content that you can share with your governments, with your donors, with anyone else who might be able to help you secure that investment. So let's get into the methodology. This was based on the survey conducted in April 2023. So we are getting that pandemic response in there as well. It was 243 shelter staff members representing 122 shelters. So this is the largest study of its kind. And our researchers used 2 different measures, 2 different surveys, one that allows our results to be compared with those of the general public, and one that we can use to compare with other helping professions. Now, I'm going to present to you in a minute all the information about what resulted from this survey, but I want to emphasize that we saw these outcomes across organization types, across save rates, and so this isn't something kind of narrowly focused on any part of the field. It is pretty general here. So some examples of what we found. This is a big old chart, but what it means is that shelter staff are pretty squarely in the middle among other helping fields. The vertical axis, compassion fatigue, that is work-related trauma and fear. The horizontal axis, compassion satisfaction, that is the positive feelings coming from feeling like you're helping towards a mission. And kind of unsurprisingly, shelter staff show up high in both of those, well within the range of other helping professions. Strangely enough, we get closest to Ebola responders, so really high stress jobs, but also really feeling like you're making a difference. And so again, people working in helping professions need investment. They need support services, they need pay, and this is something I'm hoping that you can share to advocate for your team for that. Narrowing down a little bit, we can compare particular vectors of that mental well-being with other groups. And the results don't feel great, honestly. So in terms of fatigue, shelter staff are scoring worse than parents who have infants in the intensive care unit. Also scoring worse in terms of anger compared with ICU nurses, and also scoring worse in terms of anxiety than law enforcement. So a lot of concerning data coming out of this survey. So I know that that feels heavy. It is undeniably a major problem. So we want to focus on solutions for the rest of our presentation. Again, part of that is advocacy, but another part of that is what can you do at your individual organizations? Because this isn't an individual problem. It's a structural problem that requires structural solutions. So with that, I'm going to turn over to Dr. Amanda Weiss to get us started talking to our panelists about solutions that they've found.
Hey, thank you so much, Caitlin. And so after hearing, some of that heavy data, maybe we can just start by taking a nice deep breath in and out, resetting a bit. All right. And so to get us started, I am going to invite our panelists to share something that they've been doing related to this topic of staff well-being in animal welfare. And I will actually start us off by sharing a little something. And so I myself have had the honor of working with Patty from Best Friends on creating tangible mental health resources for shelter and rescue staff. And so something we've been working on is a coping menu for resetting in, when you have 60 seconds or less, and also a guide to building, a wellness toolkit that is specific to, the context that you all are in. And so that has been really meaningful, and we look forward to be able to share it with you all at some point. And so to get us started, I'm just going to go in the order of my Zoom boxes. And again, if you want to share something that you're proud of related to this topic. And so Leah, if you would like to start us off.
Yes. Hi, I'm Leah Craig, and I am very proud that we have tried a lot of things at Brother Wolf. One of the things that has really stuck with us is nonviolent communication as a model that helps our staff find a voice and use compassion that they have in their heart to have great conversations with each other. We all know how important communication is. It's such a great starting point to build from. And so we have seen wonderful things from using that model, and our managers have taken it to heights that I never even imagined.
So wonderful. Thank you for sharing. And then we will move over to Alicia.
We've done a few things. A couple that stand to mind recently are breath work. So we had a professional breath work coach come in and lead us through breath work exercises. We've also used some apps to just take a break and do 5 minutes of breath work. And then we just started a free yoga class for staff once a month. So we basically shut down for an hour, have that room to ourselves, and just do a nice yoga practice. And everyone's been reporting that they just feel like reset, rejuvenated. They get a chance to breathe and relax. And that's provided to us for free from the yoga companies.
Yeah, so physical and mental well-being in that. Yeah, great. And Amanda, do you have anything that you want to add?
Yeah, so kind of banking off of Alicia, I think those are two great ways that we've started at Gateway Pet Guardians, along with maybe quarterly or something, we get all the staff together for maybe, we've gone to Top Golf before here in St. Louis. We've gone to one of our volunteers' pools for a nice swim and get maybe some of our volunteers or part-time workers to take over taking care of the animals for just a couple hours as staff all together, full-time staff can go and take a little breather.
As adults, we sometimes forget how important play is. We need to make sure there's still play in our life. All right, and last but certainly not least, Michael, if you'd like to share something you're proud of.
Yeah, I'm proud that we just finally got a position carved out that is focused on our staff well-being fully. So we're just advertised a position for a social worker that will be for the animal protection division and really focused on providing proactive strategies for people to deal with coping mechanisms when they do experience trauma that is inherent in this field. Both in the animal shelter component, the community outreach teams, community clinics, and our law enforcement department, especially. So that social worker, once we hire it, so if you're a social worker out there that really is excited to do this work, please check out our page. We are still in the process of hiring it. But it's really, we've seen a lot of social work positions that have been focused on the clients that we serve, which is really important. And we do have that in our hospital division. But what we're doing with this position is focusing it internally to be focused only on our staff and volunteers to help them through the challenges that they experience in hopes that we can retain really great people in this field for longer and keep them healthy longer. And, for all of us, I keep stating that this is for our staff, but this is for myself and our leadership team as well. It's for all of us so that we are approaching this with the need for being healthy and able to serve our community the best way possible.
Great, wonderful. Thank you all for sharing, and thank you all for doing really important and meaningful things. Okay, and so moving on into our next question. So how do shelters and rescues employing staff in a stressful industry with high turnover ensure that they're caring for the well-being of their staff? Anybody have any thoughts about that?
So, sorry, go ahead.
No,
Alicia.
go ahead, Amanda.
Okay, I'll go ahead. So I know at Gateway Pet Guardians, the leadership staff are really everybody. We try to encourage the use of PTO. We get that for a reason. It's there for a reason, and we want people to use that. We try to encourage employees and coworkers to turn off their notifications. Maybe it's your email, maybe it's the staff chat or volunteer chat, or anything about work. Turn on vacation responders when you're away from your email so people know, hey, sometimes I've had people reach out to my email. If they don't get a hold of me, they get on my personal Facebook to get back to me. So if you have that vacation responder on, they'll know, hey, let's not bother her. She's on vacation, using that PTO, using your personal social media for personal use only, things like that. And just encouraging like breaks or a safe space for people to talk or ask for help, or like we have the safe space to do a physical activity like yoga once a month, something like that.
I think really
Amanda,
building on the skills that we have in animal welfare. We have these amazing skills in animal welfare where we are such compassionate, caring individuals who are really connected with the feelings and emotions of other living beings. And so your staff has good ideas and a lot of good feedback. And so listening to them and really having the conversations, it can be really scary to start conversations with staff about their well-being and what you could do to enhance it. And you might have limitations, to work through, but these are people who are deeply rooted in care and compassion. And we spend every day modifying animals' existence so that they can thrive. And so how can we take that same skill set that we know so well and put that on the people that we love that work here to say, okay, how can I enhance your environment so that you can thrive, and really making that parallel and getting the staff involved in that.
Yeah, so I hear communication and valuing, the well-being of the humans as much as the value of the well-being of the animals. Great.
Yeah, and I'll just add one thing that we are really mindful of, because I agree with everything that everyone said, is, what can we do structurally to help our staff? So we've incorporated 10-minute check-ins with leadership so that we can really hear what people are struggling with on a proactive basis and address those directly. We're trying to shift to 4-day work weeks to try to give people more rest, things along those lines. But one thing that I think often gets lost in our work is making sure that we are providing pathways for support to our volunteers as they are dealing with issues that staff are, but they don't necessarily have the same connections or repetition that our staff do. And sometimes that leads to conflict that can be avoided. And so we've been increasing communication opportunities, but we also created grief support opportunities for volunteers to join voluntarily as they are dealing with loss through euthanasia or loss for animals that we couldn't move forward with medically. And I think but they're not in those conversations. So giving them the opportunity to have support and have their voices heard is an important part of that whole puzzle.
And, speaking of euthanasia, the next question that, I'll put out there to you all is, how do you protect staff well-being during difficult times, such as euthanasia decisions?
For us, we're very transparent about it with our staff. I've worked places before where it was hidden, and I never wanted that to happen again. So it is, we're transparent about it. We let staff be a part of the conversation. Staff going to take some ownership of the decision. That way they can sit in the meeting, share what they've seen. If they have a potential life outcome, they're welcome to bring that to the table. Something we talked about recently is that some of us, like in leadership, we're going to grieve at home, or we're going to keep on chugging and, in the workplace, but we might act different at home. Or some of our staff were like, oh, I'd like if you would acknowledge I'm struggling, or I'd like you to hug me. And we're like, oh, well, I don't want to be hugged, so I don't think about hugging someone. So we actually just sent out a survey to our staff that we'll be taking the results to see, like, how do you grieve and how do you want to be, what do you want someone to do when you're grieving? And then that way we can tailor it a little bit more individually on knowing what they might need.
Yeah, I would say that. And one thing that's, we're in a unique position in Massachusetts where overpopulation isn't something that's in our community in the ways that it used to be. And so we do a lot of relocation. And one thing we're really mindful of in our language choices when it comes to relocation is not vilifying organizations that do come from, have a higher euthanasia rate. And so we never, in our press releases and social media posts, we never refer to them as high kill shelters first and foremost, because that's really destructive language that we want to not repeat and reinforce. And that we always gravitate away from saying things like, we're saving these animals from another shelter. We're identifying that we are partnering with another shelter to help save these animals, so that we are notifying or telling the public that we are working together across different states and different communities and different shelter systems to work together to help animals, not in spite of one another.
And that kind of speaks to like that educating your staff. And like we start with, right in the interview process, does there seem to be alignment when we're talking about euthanasia and how we make decisions and why we make those decisions? And do they have an understanding that this is inherently a part of the work? And then as we orient that new staff member into our culture, making sure that they have the education that they need. Those of us who sit in the rooms and make the decisions, we're making those decisions on a mountain of education. So we need to give that same education to our staff so that they can have that robust understanding of the situation and of the decisions, and taking them through that educational journey ahead of, facing maybe their first euthanasia. We have found that the pre-work is so important. And then that is forming those relationships also with staff during that pre-work. And something really beautiful that our staff came up with recently on their own was that it would be meaningful to them to write notes or letters to the animals that we're saying goodbye to and put those with the animals. We do cremate our animals, and so those notes go with them. And that's been a really beautiful thing for staff and very well received.
Something I forgot to add earlier is that we now have a memorial wall, and it's something that the public can purchase. They're pet tags that we hang, and there's a beautiful mural and like a beautiful quote. And we also make tags for pets who might be euthanized in our shelter to still be able to honor and memorialize them. And then any staff who wants a paw print is welcome to have a paw print to keep. Occasionally we do send ashes with people if it's a pet they were particularly close with, or a volunteer might request the ashes. And that's something we're always willing to do if someone requests.
I want to add on that with Alicia too. Along with our memorial wall, we recently started a memorial Facebook page as well. So not only for staff, but it's another way for volunteers, you know, to pay tribute to our friends with, you know, maybe the adventures they had, the time they had to them, and just pay tribute and show the love that they had for them. And that's a Facebook page that people can opt into if they want to be on it. And if not, they don't have to be. It's not out there for the whole public to see, but if you want to opt in, you absolutely can.
And so it sounds like you are all addressing this, you know, from both ends, you know, the preparing for this and then, you know, the going through it and how to have support after and cope with it. You know, grief is universal, yet it's as unique as a fingerprint, right? We all have our own grief experiences. And so being able to find out, you know, how others need to be supported, you know, preparing, communicating, so helpful. So to follow up on an earlier question, Erica was wondering, as far as the 4-day work week, is that a 32-hour full-time schedule? I think, Amanda, you may have been speaking about that, or Alicia.
Oh, I think it was me.
Sorry.
So we are doing 4 10-hour work days. So we are trying to still, you know, we still need the work hours to be able to complete the work that we need to do. And we wanted to stretch out our day a little bit to provide access for our services on each individual day, while also trying to find more space in people's life to be able to have the rest that they need and decompression. So it's an experiment. Can't do it at all of our locations and all of our departments, but where we can do it, we are shifting to it to try to give people that necessary downtime.
Okay. And then another question that came in, how do we convince donors and watchdogs that staff pay is a good use of donated funds?
I personally would use data. I think data speaks volumes. So especially if you're wanting to add a staff position, showing, you know, has your intake increased? Are you trying to return more pets to owner? Looking at your data to paint the picture as to why there's a business need for it. But then you can also look at staff retention. So if you have a staff retention problem, and that could be because you aren't getting, people are not staying. If you find out the reason people aren't staying is because their workloads are too big, that's a great way to show that as well. So I always refer to data. Like anytime we add a position at GPG, when I go to the board and ask for approval, I have like a full like case statement of why we need it and the data and the convincing reasons, and then how we're going to get the money. And so far I've never been turned down.
And so how have you seen staff well-being affecting animal well-being?
Well, I would say, I mean, I think the important thing for all of us to recognize in this field is that we are a people field. We are not able to do anything for animals without doing it with people. And that means our staff and volunteers, and supporting our staff and volunteers, as well as trusting and engaging our community in a people-centric approach. So we're really a people organization that is influencing and helping others to help animals. So I think it can't be stated enough that people are the most important part of the equation. Even though we work on behalf of animals, the way we do that is to make sure that the right people are doing the right work, supported the best way that they can, and given the tools that they need to be able to do the job really well.
Yeah, I like what Mike had to say right there. It definitely goes back, we're always asking for fosters or adopters or donors or volunteers, and that goes back to the people. And then to be able to show up for those people as a staff member, as a volunteer, I know personally when my well-being is lacking, my creativity is lacking, my flow's lacking, I may have more of not as approachableness to me that day. So, and having to take care of yourself first and foremost, and making sure you're filling your cup so you can take care of another living being, whether that be an animal or a community member coming in. I think it's very true. To help others, you have to go back to the core self and help yourself too, in whichever way that works best for you.
And then what about community well-being? How do you see staff well-being affecting the well-being of the community that you're serving?
Well, I think if we're not healthy, we're not going to treat people the way that they should be treated. So I think, this field suffers a lot from, I think, a lot of untreated trauma that sometimes gets dumped on the person that's coming through the door, and we lose that trust with our community. And I think it's represented a lot in the way that we approach adoption applications and how we talk about people who surrender animals, even though it's a service that we provide, and we get upset that they take advantage of a service that we provide. So why are we upset that they're taking advantage of something that we offer and is needed in the community and is a good choice for the animal as opposed to the alternatives? And I think we reject and are suspicious of people who come in to adopt that we have asked to come in to adopt and be part of our mission, but then we don't trust them. So I think that's rooted in sort of a lot of that trauma that's not proactively being treated, and often comes out in unfriendliness, unwelcomeness, distrust, and all of the things that I think we get criticized about as a field. But to be able to treat that, we need to support our staff. And I think we sometimes don't realize that those are interconnected. And if we keep our staff healthy, that means we're going to be better to our community, better service providers, and ultimately get to the mission that we all share, which is making sure animals are protected and loved and cared for. But we got to be good to people to do it.
Does anybody else have anything they want to share before we move on? All right, and so we have a request for our panelists to share how large your organizations are. So how many staff you have and how many volunteers.
At Brother Wolf Animal Rescue, we're in Asheville, North Carolina. Our annual operating budget is $2.5 million. We have 34 staff members. A couple of those are part-time. And we have about 450 volunteers active in any given 12-month period.
I can go next. I will sort of say it two different ways. The MSPCA has about 850 employees that are spread between all the different functions that we do. In the Animal Protection Division, we have 181 staff and about 1,200 volunteers and foster families, give or take. So we have a very large footprint. We are spread across the state. We manage multiple properties and a lot of different functionality within the animal welfare space. And I think it's really important to say that we recognize that we're a large organization, and as a large organization, we have some additional resources, and we're lucky enough to be able to shift some of those resources to be able to provide something like a social worker to our staff, and recognize that not everybody is in a financial position to do that or could make those resource choices. I think what we recognize is that we don't think everyone can repeat what we can do, but we recognize that we sometimes by making certain decisions and choosing certain pathways, that we can sometimes inspire others to do different things in a way that they are able to achieve. So just bringing this to the forefront by hiring that social worker position, I think is bringing attention to the mental health needs that the animal welfare field requires. And I think just elevates that conversation. That's what we are hoping to do, but recognize that we are unique as a large organization.
At GPG, we're similar to Brother Wolf. We're like about a $2 million budget, about 30 employees with 25 full-time, 5 part-time. And between fosters and volunteers, I think it's about 900 people total come through per year.
And so Megan is wondering how you get staff investment for the fun activities, right? That even when schedules are adjusted or closed early, that there seems to be limited participation, particularly amongst those who really need these fun activities the most. And so how do you get that from your staff?
We have our HR person be very proactive about talking to individual staff members about it and really hyping up like what we're planning, you know, and making sure that we're taking their feedback. So we take a staff survey at the beginning of every year to say like, what kind of activities do you want to do together? We give them a lot of ideas, but they can also put in their own ideas. And then we try to, you know, choose the ones that were the most popular. And then we really do that face-to-face contact. Like, hey, did you hear about that thing that we emailed you about? Like, are you coming? We'd love to have you there. You know, different staff like different things. You kind of get those personalities, you know, like, oh, you know, we're Asheville, we love breweries, like, oh, these people love breweries, oh, these other people love, you know, playing games. And so like really trying to mix it up and speak to those staff members and get that camaraderie feeling of like, this is gonna be so much fun. Like, I really hope you're there. That face-to-face has really helped.
So we have for our hourly employees, if we adjust the schedule, so say if they normally work till 7 p.m. and from 4 to 7 we have an event, they would get paid. So if they don't go to the event and they just go home, they don't get paid. So we have pretty good engagement. We do have some people who just can't make it for, you know, childcare reasons or whatever. And then I've also recognized like some people's way of self-care they just want to go home and not be with work people. So it is kind of recognizing like not everyone's we call it language of appreciation. Not everyone's language of appreciation is quality time. It could be something else. So we have had a survey that we need to probably do for our newer staff, but see, it's basically your love language, but your language of appreciation to see maybe that doesn't work for some people, and other people would like a gift card or a day off or whatnot.
And with your volunteers, when you have, you know, volunteers who are volunteering so much time, it's almost like full time, how do you encourage them to take breaks, you know, maybe without invalidating or offending them?
I think it's super important to have open dialogue, and I think we, you know, apply the same techniques that we would with staff to volunteers and treat them, you know, as equals as much as we possibly can, engage them as much as we possibly can. And I think we certainly have seen the trend in which some volunteers who start to get more and more invested, and initially everyone craves that because they're giving you more time and you really rely on them, often do struggle at certain points and can go from your best asset and like, you know, most important person to sometimes becoming a real challenge or detractor from your what you're doing. And so I think, you know, that's where really having a really good volunteer coordinator who can stay focused on identifying and hearing those issues from staff and empowering staff to engage directly rather than putting it all on the volunteer coordinator. I think, you know, trying to create that ecosystem in which you're giving them individual feedback and opportunities to hear their point of view is really important, just like it is for a staff member. But hard to do. There's volunteers often outnumber us 5 to 1. And so it's hard to give all that personal attention, especially as they may be there once a week and may not necessarily always be on the schedule of the volunteer coordinator. So it does take a lot of additional coordination and effort to be able to address their needs, and finding new pathways is a journey we're still on.
And so how do you all as leaders continue to provide care and support to your staff and volunteers, even when you yourself as, you know, humans are struggling with compassion fatigue yourself, burnout, or any other mental health struggle?
We found it really helpful to have those open conversations, kind of like Mike was saying, like with our leadership team, and say like, you know, just be honest with them and what's happening with you, and then people sharing what's happening with them and coming up with ideas. We had a meeting where we challenged every single member of our leadership team to set a boundary, and we all wanted to know what that boundary was. So for some people that was like, I'm going to leave at 5. I'm actually going to leave. Or I'm not going to look at my email on the weekends, or I'm not going to answer, that phone call if it's not an emergency, if it's after hours. And so we told each other all of those boundaries, and that helped us hold each other to those boundaries, because it's very easy to let yourself slip. But if you know that your team knows that boundary, and if they're popping their head in and saying, hey, it's 5:15 and wasn't your goal to leave at 5 every day? It made an incredible difference to share those things with each other, and then to help support each other. And over a period of a year, we all got to our goal.
I would say for us, one thing that we really established as a baseline for our culture is proactive conflict resolution and communication through conflict, because it exists at every level and it needs to go up, down, and sideways. It can't just be something that is expected from leadership to give to staff. Staff need to give that to leadership. And one of the things that I think is really powerful in that is, there is a hierarchy. We recognize there are bosses and employees, and that sometimes shuts down that feedback loop. But all leadership giving permission to each other, and up and down the chain to sort of give permission to give feedback to their boss when their boss is struggling and not being the best they can. That is an early sign that that leader is struggling, and needing to hear that honest feedback is important. So I give all of the everybody permission to check me when I am struggling, or when I might not be operating in the way that we've defined that we want to operate, with our culture of conflict resolution and respect for each other. So I think that it's powerful to give permission to give feedback, and to live a culture that you give and receive feedback on a regular basis, and it becomes more normalized as opposed to awkward.
Yeah, I think that's a great point. Again, like if we're having staff meetings once a month, or I like to check in with my individual employees, like every monthly check-ins. If they need it more, I always tell them, like, if this is something you need more, come to me, talk with me. I like to lead by example, to encourage. I'm a very open person, so I will openly talk about, my struggles that I'm going through, or I'm seeking therapy outside of work, or what I have done to help my work-life balance. And not everyone is as open as I am, so I understand that. So I encourage people, if you are open about it, feel free to talk to it, or come to me one-on-one if you're struggling on something. And then just be okay talking about it. And we all are together a lot during the week. This feels like our character, and this is our role in life. Of course, we have a huge passion for it. So really leaning on each other, and maybe, hey, I've noticed you do well at this. How can I get started? Just opening up and asking questions, and asking for the help that you need.
And what recommendations do you have for staff who are feeling burnt out by the volume of tasks and responsibilities that they have each day, that are brought about by low staffing and high demand for services? So as opposed to euthanasia, when there is a max kennel capacity.
I mean, I don't know about what advice I give, but we really rely on volunteers. So if we're low staffing, we offer incentives to our volunteers. So we get points from our credit card, and then we get gift cards. So we'll incentivize our volunteers, like, hey, our staff could really use some extra help. We're over capacity today, or we have a staff member out sick. Who can come volunteer? The first 3 people to sign up will get a $25 Amazon or Starbucks gift card. So we just try to find support for them in any way we can. And some volunteers take the gift card, some say give it back. One volunteer one day said, there's only one animal care person working. Will you give my gift card to her? Which I thought was really sweet. So we're just trying to get them the support that they need. And obviously the leadership will always jump in to help if they're struggling as well.
All right. And how do you get leaders to loosen up the reins a bit and be graceful with themselves and others? So Faith mentioned that leaders tend to take on more than necessary and burn themselves out too. And so how do you address this?
You definitely do have to lead by example. And I know that's so cliche and we've said it a few times already, but I mean, you can watch your staff shift, based on the way you're showing up in all regards. And so being really sure that you are maintaining that work-life balance, that you are taking care of yourself and you're putting your best practices out there for others to see, like you are leaving at the end of the workday. And it gives permission to everyone else to behave in that way. You're setting the standards for what success looks like at your organization. And if you want success to be that healthy balance, then making sure that you bring that healthy balance. And just like Mike was saying too, we really could benefit from the entire industry making sure that not only are we extending compassion and care to ourselves and our employees, but to each other, because we're setting the stage for that visceral, right? Like if we're doing it to each other, if we're doing it on a national level, how are we ever going to change what's happening below that? So if we're talking about how leaders are acting, we also need to look at how are organizations acting? How are we talking about these things? Why are we calling some shelters kill shelters and no kill shelters? Like, why are we using this terminology that pits us against each other? And then we're wondering like why we're not thriving. It just doesn't make sense. It's a trickle down effect. And we have to change that as an industry at the top levels so that we can bring kindness, care, and compassion at every level.
Yeah, I would, 100%. You said it really beautifully. And I just want to highlight that and also suggest that when people get frustrated internally or externally with the results that are happening or the challenges that you're facing, we lead a lot with criticism in this field of why are they not having the success? Why are they not doing this? And not a lot of times in which people are saying, how can I help you? And I think if we shifted to a reality in which we supported one another, and I will give a huge props to Best Friends and the Shelter Collaborative Program as something that I've really enjoyed seeing happen and grow within this field, and something that we partake in, because I think there are times in my career in which I really needed to lean on other organizations that were willing to help us. It's something that I'm very happy that we are past the point of overpopulation and no longer the shelter that's overwhelmed. And we are now excited, and our teams are all engaged with helping other shelters through challenging times too. And if we start to recognize that it's not just about what happens within our building, the success for us in this field is that all animals everywhere are protected and have what they need, that we have to do that together. And we separate so easily over things that are small differences, or even feel like big differences, like euthanasia. But really, we separate quickly over those small differences, and instead of struggling to stay together over the things that we have more in common in a shared goal. So I think really, if you're in a position where you feel like you're really frustrated with another organization and you're not getting and you're critiquing them a lot, I'd encourage you to think about how that's impacting them, their well-being, and whether that's even really going to get them to a place where they're healthier, and what you might be able to do differently tomorrow to try to help support that team. Would be a dream come true to come away from this presentation that everybody just rethought how we're acting internally and externally, and offered some support instead of critique.
And so another question that somebody had that I think you all touched upon a little bit in this, but I'm wondering if there's more you want to add. What unconscious biases do you think need to be addressed by rescues and shelters? So unconscious beliefs or, kind of stereotyped assumptions, maybe present, that need to be addressed.
We never use the people suck language. Those words are forbidden. No one says them here, but that's set up from the expectation of the job description to the interviews that we are here to help people. We're here to champion a thriving pet welfare community. We work with a really low income population who may not love their pet to the standard that I love my pet or whatnot, but we have a culture that we're just here to help people, and we're here to involve the community in the solution, and people are inherently good, and that is just the culture we have. And I think that makes a huge difference because it's such a positive culture. If we get in a dog who's been hit by a car, a gunshot wound, we don't go, oh, that poor dog, look what someone did to her. We're just like, oh, this dog's here, time to help it. And that's just how we go about it. We don't look at the negative and dwell on it. We just move forward. And I think that makes me want to stay here and work here. And I wouldn't want to work somewhere that villainized people.
Yeah, I'll thank you for saying that. And I think just sort of note that one of the organizations that's being created right now that I've helped to get off the ground, called Spark, is really focused on changing the messaging in animal welfare. So check it out if you're seeing it's SPARC. And the whole sort of foundation of what that's being built on is the long-term messaging related to vilifying people and the actions that they have, like this person abandoned this animal or surrendered this animal, and we keep painting them as villains and us as heroes, instead of looking at the macro systems behind them and systems framing the challenges that are in animal welfare. We are really good at vilifying people. We're not really good at taking a step back and looking at what are the big systems that we can attack and approach, do solutions for, that will create bigger change, and that our messaging really needs to be not on the individual person, but really focused on how do we fix those systems to get better results for animals, like housing, for example. If this person had to surrender their animal or abandon it because they lost their house, and we're vilifying their actions instead of looking at why is that housing issue not supporting people that have pets, and how do we approach that from a systems approach. So I think that systems framing and our language, those all really do matter. And I think it's important that we all shift to more human animal bond centric approach to our work, instead of that sort of villain hero, because it's really destroying us and it's impacting everyone's mental health and animal welfare the more that we continue to repeat those same tropes instead of changing them and getting different results.
Yes.
And
Oh, go ahead.
No, go, please go.
I was just kind of going back on what we said earlier on what Mike and Alicia had. At the end of the day, if we don't have people helping, because they're the fosters, they're the volunteers, they're the adopters, they're the donors, they're the ones that share our posts on social media, we don't exist. So we can't villainize people, and we can't, use those terms of, well, I love this animal more than so-and-so, or why doesn't this owner care as much as I do? That's not the case. It's way deeper than that, of housing issues, or not knowing what is in the community for resources on spay and neuter, or a TNR program or something like that.
Yeah, no, and I think this is so relevant. There's this idea that language can cause our suffering. And so being mindful, the semantics matters here. So really helpful.
And ensuring that staff have that education, because if, we're oftentimes saying like, gosh, I wish we could hire someone with better customer service. I wish we could hire someone who is a better conflict manager. I wish that we could have staff with greater empathy or aware of their bias. Well, a lot of that stuff takes training, and we don't learn these things just in the air, and we don't see a lot of good examples of them on television. And so we really need to step into that space and say like, okay, we're going to do trainings on unconscious bias, right? We do that routinely here. And we're going to do trainings on empathy building. We do that routinely. It's like growing that human for who you need them to be in this space in order for them to do well, in order for the humans and animals that they're interacting with to have a good relationship. People do not learn these skills in school. They do not learn them in college. They do not learn them usually in their families, and they don't see them in our politicians very often. And so the onus is on us to create the reality that we want by pouring into our staff and giving them the skills to show up in a way that we want to see.
Yeah, I love what you just said, and I'll just add one part, because we started this conversation with what systems are we building to support staff. I think the other part of that conversation is what systems do we need to tear down to support our staff? And when we think about a lot of those implicit bias that have developed our systems that exist and have been repeated for decades, I'll give you an example. Our adoption applications, how many times have people actually examined why do we ask the questions in our adoption applications and approve and deny people for their answers to those questions? And the why did we decide that was asking somebody about their vaccines on their previous animals, or they're feeling like we have to verify with the landlord some of those are based on long-term biases that have existed in animal welfare that we've not continuously re-examined. And as we teach our staff, we should also challenge ourselves to think about reinventing ourselves and reconstructing some of the ways that we approach how do we work with people, and instead of just staunchly defending the application that we've had for 35 years. So I think it's important to do both, tear down and build up.
And then let's say you have a staff member who, is experiencing significant burnout and it's impacting the rest of the team. Right? How would you address that staff member? I know we've been talking about the team as a whole, but when there's one person that seems to be impacting the rest of the group, how would you address that with that person?
Well, I think you'd have to have some honest conversations with them about their impact on the team, their own well-being, what support that they need, and whether they can continue. I think one of the things that sometimes people continue in this field long past the point in which they can be productive to the community that's there. And a sense that sometimes that's because of a sense of duty or worry that if they leave that something will fall apart behind them. And it's okay. Sometimes people need to leave this field and, or move to a different organization even and get a different perspective, because if you are living through burnout and impacting others, it's really challenging. And I think that's why we're, quite frankly, that's a component of why we're investing in a social worker for our team, just recognizing these cycles that continue to happen over and over again. Is we don't give them, the tools to be able to deal with what we know they're going to deal with. Through traumatic situations or just challenging situations. So we aren't preparing them well enough, and so they people will start to burn out, and then we really care about them, so we try to counteract that, but too late. And then this sort of, sometimes people stay in there and they become a destructive force in the team. And I think if we started to think about why those cycles build over time and repeat over time, and think about starting at a different point and providing support earlier in the process. A lot of the awesome people that I'm on this panel with have identified ways in which they've done that. And I think if we all start thinking about how do we proactively solve this issue instead of trying to deal with it after it already happens, we might get to a better place in a longer term success point.
And proactively telling our staff, like, this is probably going to happen at some point, so every new staff member, they sit down with me and I talk about mental health, and I talk about the resources that we have. I tell them, like, you are going to look at things every single day that most humans will never look at. You are working in society's problems instead of profits. And that is very different than most of our world in the United States. And so there's things that you're going to experience here emotionally that most of your friends and family will not understand. And so, like, from the very beginning, like, just laying that out and saying, like, I want to support you. These are things that we have put in place to support you. You have free access to therapy. We bring in a therapist every quarter to meet with our teams. And so that means that they're having introduction to a therapist, to therapy. Maybe they've never done that before, but then they can access it. And knowing, like, oh, okay, the executive director talked to me about burnout and about wellness and about mental health. That means that there's already a pathway made by leadership that I can jump into. And then I can say, hey, this is happening to me, or I do need to have this hard conversation, and really encouraging them, like, we need you to talk about this. We need you to tell us what's going on with you. And then it just becomes part of the culture that people talk about it in positive ways and in hard ways.
So I think we have time for one more question. And so, you are all in a people industry, yet it seems at times that the community forgets that you're all human after all, right? And so can you give an example of how you've done public messaging to emphasize to your, community that the people who do the work, are after all people? Sarah pointed out that there's still an ethos that we should sacrifice ourselves. And in the court of public opinion, the hard work and compassion that you all bring is often not a consideration.
Well, I think I'll just say that we have shifted a lot of our language, again, away from that sort of villain hero trope, and purposely and intentionally taken away some of those language choices that have existed in our organization for a long time, and started to actively tell people why we're going to message to them differently. And then we defend it in the comments. In social media, there's often a time in which the Wild West happens in the comments, and I think we take the time to address those, and we proactively address any legitimate complaints that people have, and we defend our teams when they should be defended. So I think it's standing up for our staff, whether it's, for example, I think every June we brace for impact when we change our logo to a rainbow logo, and we support Pride proactively, and we see so many negative comments in our social media comments, and we very much defend our team in there, and we don't allow that to exist. But we also teach at the same time. We give people the understanding of why we're not going to allow that to happen, give them the opportunity to learn.
Something we've done on an individual basis that we've empowered our staff to do, and I did send Caitlin the examples, is that we have certain staff members that they get tagged constantly on Facebook of like, help this animal, what about this? They get private Facebook messages. So they made posts and then like pin them to the top of their page that say, this is my work number, this is my work email, I will not be responding to requests on Facebook. And then kind of explain like, I want to work in animal welfare for the long term, and my having boundaries and my mental health is important. So I ask you to respect that. And when I go on vacation, I won't be responding to anything. Here's the work information to contact, and then they pin it. And then if they get those messages, like someone still messages them like, oh, will you help this cat? They literally just copy and paste their pin that they put on top of there. And I just think that's so impactful, and would love for more and more animal welfare staff to do that, to really stand up for themselves and have organizations and empower their employees to do that.
And having leadership stand up for your staff makes such a big difference to those staff members, and like teaching our staff like de-escalation techniques, because they're going to need to use those with the public sometimes. And then when maybe those de-escalation techniques are not working and they bring in a manager, making sure that that manager really has that staff member's back in that situation, that makes such a big difference for the longevity of that staff member. And we get a lot of people who come from, maybe like restaurant industry, and they're not used to their managers having their back. And it blows them away when we have their back, we stand up for them, we use the same skills that we've taught them, and we have boundaries. If someone is screaming obscenities at our staff in the lobby, that is a boundary, and they're not going to be in the lobby anymore. And so having your staff's back and giving them the tools that they can use, like de-escalation.
Yeah, I think also last thing I'll add to, like, kind of going off of what you said, Leah, de-escalation in the workplace, but then also being able to come home and de-escalating yourself from the work day, putting your central nervous system literally back into its place and regulating your body, whether that's a walk just till you come home and you can't start dinner or something yet, go on a walk, or that's yoga, or that's sitting on the couch and not listening to anything for 10 minutes or watching your favorite TV show, whatever it is for you as a person, really honing in on that and how to come home from work and be able to do the rest of your life too, because there's other components.
That is an incredible transition as we all end our day today. I hate to interrupt this incredible conversation, but I also want to respect everyone's time. Angel, if you could throw the poll up, everyone, I would appreciate if you filled out the poll. It makes sure that I provide content that is actually worth your very valuable time. And I want to express really sincere thanks to everyone who attended, who's going to watch it recorded, to Dr. Amanda for moderating, to Amanda, Alicia, Leah, Craig, and Michael for being part of this. Was really glad to see the many directions that this conversation went in. We will be reviewing the questions that we have, the chat, to inform future Best Friends Network offerings. So please stay in touch. Let us know if you have any questions. So thank you all. Please complete the poll and have an incredible evening.
Thank you.
Bye.
If anyone's on filling out the poll, I'll tell you my animals' names. I have Rue, and Moira Lavaniti, and Siobhan, who is a kid.
Thank you for hosting.
Thanks.
Yeah, this was awesome. Thank you so much.
Really appreciate you all. So the recording, I saw Stephanie ask in the chat, we will send it out probably Friday, maybe Monday, but we will send out a follow-up email. It will include the recording, the presentation deck that I used, plus some extra information that you can use to contextualize, and maybe some of the resources requested in the chat here. Great. Thank you all. Have an incredible day and really appreciate you.